Welcome to your second PowerPoint for Unit 1. Scanning planes are based on the anatomical position. So the anatomical position is with the patient laying flat, supine, which is face up, and their palms facing upwards, which is why the skeleton is in the anatomical position. But the girl on a stretcher is not, because her hands are face down. Each image that we make is based on one of these scanning planes. So they are very important that you know what they are and understand how they look on the screen. Our first scanning plane is the sagittal plane, also called longitudinal. A lot of times you'll see these abbreviated, so you'll see either long or you'll see SAG, just S-A-G, on the image itself. The longitudinal plane or sagittal plane actually splits the person into left and right sides. Mid-sagittal just means it is right in the middle of whatever it is they're splitting in half, and then anything off of that is just sagittal or paramedium, but that term is not used that often. It's just sagittal. Our sonographer here is doing a longitudinal or SAG image of an upper abdomen, really a picture of a liver. So when you're looking at these, you want to understand the relationship of the anatomy to the scan that you're looking at. So when you're looking at a sagittal plane in the traditional format, and what we mean by that is the patient is laying supine and their head is toward the top. In that position, the top of that screen that you're looking at right now is anterior. That's where the foot of the transducer is, so that's anterior. Bottom of the screen is posterior. The left side of the screen is superior, meaning towards the patient's head, and the right side of the screen is inferior, towards the patient's feet. And that is very important for you to know. Our next scanning plane is the coronal plane or frontal plane. Now this plane divides the patient into anterior and posterior. It would be as if you were looking down from their head and you could split them in half. This is the one plane that is not used that often in ultrasound. When we do neonatal heads, because we actually are putting the transducer on the top of their head, or when we're doing transvaginal ultrasounds, and again, because of the angle that we're going in, we're doing coronal planes. One of the other ways that we do a coronal plane is when we're scanning the kidneys, in particular the left kidney. Because of its position and the anatomy that's in front of it, a lot of times we'll turn the patient up on their side and truly be scanning from the side. So we're doing more of a coronal view of the kidney. This picture showing you the left kidney in a coronal view. Again, the orientation is going to be different. If you think of the foot of the transducer, which is always the top of the screen, you now have it on the side of the patient, on their left side. The top of the screen is actually showing you the lateral portion of the kidney. The bottom of the screen is the medial portion of the kidney. The top is still the superior part towards the patient's head, and the bottom is the inferior part. Our last scanning plane is axial plane or transverse plane. In ultrasound, transverse is the more popular term that is used, and a lot of times you'll see it written as just trans on the image screen. Transverse plane divides the body into upper and lower halves, or cephalic, which means towards the head, caudal, which means towards the feet, or the other way you'll hear it is superior and inferior. And you need to know those are all the ways. Most of the time you're going to hear people reference superior and inferior, but in a test it might be cephalic, caudal, so you need to know what the differences are. This sonographer has her transducer in a transverse plane on the patient's body. So the image up on the screen again is of the liver, But what I want you to look at is the foot of her transducer is on the anterior part of the patient's body. Top of the screen is anterior. The bottom of the screen is posterior. To the left of the screen is the patient's right side. To the right of the screen is towards the patient's left side. Plane that divides the body into the left and right half was B, sagittal plane, in the question above. Now, there's a lot of terminology when we're talking about the anatomy and how we scan and which way we move the transducer. So this is all like new language for you guys, but it's a language that you need to learn. Prone just means laying face down. Patient would be laying on their stomach. Very rarely do we scan in a prone position. Most of the time we're scanning in a supine position where the patient is laying face up or on their back. Medial just means towards the midline of the body. Lateral means away from the midline of the body. But you need to understand those terminologies. You could be scanning a liver. A radiologist could come in, or even as a student, and your clinical instructor will say, well, I want you to go more lateral. Well, which way are you going to move? Well, you're going to know that lateral means away from the midline. So you're going to go more towards the patient's right if you're on the right side of the body. If you happen to be on the left side from midline, remember midline is the middle, then you would go more towards the patient's right side. And we'll go over all this in class when you're scanning. If you don't understand any of this terminology, though, please speak to me in class. So besides learning terms related to scanning planes, there's also things called regional terms, and they just describe a region of the body. It's become important because when a doctor is sending in a patient, he might write on a script that the patient has a mass in the antecubital section of the left arm. Now, of course, you can ask the patient where the area is that needs to be scanned, but you might come across a time where a patient doesn't know where it is and doesn't know exactly what he wants. So you need to know these kind of basic terms. Axillary means armpit. Obviously, umbilical area would be around the belly button, but they do become important terms to know. In the above question, the answer was superior. Again, if you don't understand it, speak to me while we're in class scanning. Lots of times it's easier to show than to explain, so we'll definitely go over that. Now, we've been talking about scanning planes. The thing to remember is in the human body, organs do not lie straight up and down or straight across. A lot of them are tilted or turned. Some of that is normal in every patient. Some of it is specific to patient body habitus. We do a lot of what's called organ-orientated scanning. That means that our transducers are transverse and longitudinal to the organ, not necessarily to the patient's body. Ones that we'll look at in particular are the pancreas and the kidney. The kidney, if you look at that picture on the right, the top part or the superior part of the kidney is actually angled in a little bit more than the lower part or the inferior pole. One of the things that we do that's important for our kidney is to measure the size. It's an indicator for medical renal disease. If we take our transducer and kept it straight up and down on the patient's body because we're doing a sagittal view, we would not really get a true longitudinal view of the kidney. And so a kidney that is probably 11 centimeters in length, we would measure maybe 9 centimeters in length. That's where organ-oriented scanning becomes important. One of the other things we have to take into consideration when we're scanning is how perpendicular our transducer is to the organ of interest. The sound waves that hit a structure and come back to the transducer are the strongest when they're the most perpendicular. So that's the other thing that we look at when we're scanning an organ. The uterus is the example that I'm using for this perpendicular scanning. The uterus normally has a bend to it, so it actually sits almost up and down and not straight out. If you were to scan, you would not be hitting the uterus perpendicularly and you would not get good pictures at all. So when we scan the uterus, we do two things. One, when we ask the patient to fill their bladder, it actually helps to push the uterus down a little bit, but it never makes it completely flat. So when you scan the uterus, you actually angle your transducer superiorly towards the patient's head. And that makes you a little bit more perpendicular to the uterus itself so that you can get good scans. Another term that you'll hear is someone will say, well, we need to scan subcostally or intercostally. So you also need to know those positions. So intercostally, that little man is a bodybuilder, and that's actually called an intercostal position. You know how they move in different poses. So that's an intercostal pose. What that means is you're going to be scanning in between the ribs, so the costal spaces. Now, subcostally would just mean that you would go underneath the ribs and kind of angle up. And these are all ways that we try and get different images so that we can see whatever it is we need to see.